What we're looking at here is, and I don't usually start with it, but it's the final product. And the reason that we're talking about the final product is because a case like this, that started like this, involves a whole lot more than just porcelain veneers. And this is why we got Dr. Gottesman here today with us to talk about perioplastics and exactly what crown lengthening is. We're gonna show you raw, so if you don't like blood, don't watch this. But this is gonna be a full understanding of what crown lengthening is. So let's dive right into it. What we're looking at in this case from a dental standpoint is a few things. It's really important to understand that she has a cant that slopes her teeth like this. And in addition to a tooth cant, she also has an angulation of the front teeth, which is a midline cant. So what we're gonna do in this case is we're actually going to correct for both things. Not only are we gonna correct for the cant of her smile, but we're also gonna be correcting for the tooth, the midline cant. In addition to that, from a dental standpoint, color of this tooth versus this tooth, shape of teeth, size of teeth, and position of teeth. So now we're gonna jump into the whole gum process, the perioplastics with Eddie.
So when I look at a case like this, one of the things I assess is the lip symmetry, the gingival or gum symmetry, because those two things frame the smile. And it's obvious in this patient's case that her lip is uneven. If you look, it actually takes a little bit of an elevation as you approach her left side. Now, it turns out this patient had a prior injury where she does not have the same amount of muscle pull on both sides. So on her right side, her lip doesn't actually elevate, doesn't go up as high as it does on her left side. And that explains why her lip doesn't look even when she smiles. But in addition to that, as Dr. Alex had just mentioned, she has a cant, and a cant basically means that your teeth, the entire jaw is not level. So this side, her left side, actually is lower than her right side. And the way you can tell that is by looking and seeing that there's a lot more gum tissue that shows here than it does right over there. Because on this side, on her left side, her jaw has basically grown further than it has on her right side. Now, to address this problem, there's two options. And one of them involves jaw surgery, which requires a hospital stay, and it's a lot more involved, it's more costly. And in some cases, that's the only way to address it. But in her case, it was mild enough that we were able to address it using a different approach, which is a combination of cosmetic veneers and crown lengthening or periodontal plastic surgery. Here you can see up close that on this right side, her gum level here is barely showing. Here it shows a little bit. Compare that to her other side, her left side, there's a lot more gum tissue that shows compared to the other side. And this uneven display of gum tissue or gingiva is oftentimes going to ruin the smile even if the most beautiful veneers are done.
And in this case, the other thing that you can see is that we're going to be taking the position of these teeth and not only raising the gums, because if we raise the gums without doing anything to the teeth, we're going to have these enormous teeth. And that's not what we want. So what we're doing with this case is we're actually repositioning, we're creating the illusion that we're moving the teeth, and in addition to that, the gum and the bone has to follow that. Because what do they say in dentistry?
Bone sets the tone, but the issue is the tissue. That's right, that's right. I wasn't sure where you were going with that.
I was going with that. That's where I was going with that.
That's a good point, though. You know, we're essentially trying to mask a problem here, and you can do this in certain cases, and this happens to be a case that qualifies. So here's a part. Actually, I'll hand this back over to Dr. Alex because this was where he got involved at the beginning.
Awesome. So this is very simple. We work as a team, and what I'm saying as a team is the first time I saw her to start doing the work, I reshaped the teeth, I put her into temporaries, lasered the gums, put her into an Uber. In 10 minutes, she was at Eddie's office, and he started doing his process which he's going to walk you through from start to finish, what the tissue is going to look like, what the bone's going to look like, and how he got there. And this is awesome.
So I was very fortunate to receive a patient who was already numb, so thank you for that. At this point, you can see that the laser treatment addresses a little bit the length of the teeth. So you can tell that there's a little bit more length, there's a little bit more white showing in the smile, but it's not enough, especially if we're talking here about trying to address the original cant that we were talking about earlier. So in this picture, you can really see that her bone level has a very flat and uneven and imbalanced level. So this is why we can't get a good cosmetic result without addressing the frame. The frame, which is the bone, needs to be arcuate or parabolic. It needs to be symmetric. And in her case, it needs to be higher on her left than it is on her right. So if you can get the bone levels to look correct and balanced, then the veneers will look more natural. The other thing that we do in this case is address what we call buttressing bone, which you can see here on this left and right side. And what that basically means is there's a lot of extra bone. It's also termed an exostosis. What we're going to do with this extra bone is shave it down, trim it down, but make it still look natural once it's been removed. Here's a close-up that shows, again, this large amount of extra bone that doesn't need to be there on her right side, and the same thing on her left side. Again, this large amount of extra bone volume that doesn't need to be there. We do what's called odontoplasty, or removing unsupporting bone. And in doing that, we can make this look a lot more natural. In this picture, you can actually see that we've actually accomplished our first phase, which is to get the anterior 6 teeth looking more balanced and symmetric. The bone has been reduced. It's only been reduced a little bit in order to create space for the tissue to reinsert onto the tooth's root. We call that the biologic width. And the next step was to address the posterior or the back teeth. So we're gonna work now on her molars on both sides. So in this case, on this photo, you can see that this area on the front has been already addressed, and we're now going to work on the posterior molar teeth. We, at this point, took all that bone away. We also shaved a lot of this bone, made it flat.
What do you use to do this?
Good question. So there's lots of different instruments that you can use, chisels, drills. I use a small fine burr, which is a diamond burr. It's a round rotary instrument that shaves the bone, and I use larger size burrs, and then I decrease them from a size 6, 4, and then finally to a size 2, and that allows me to get really fine detailing into the bone. It's important to recognize that the bone needs to be worked on just like the teeth do to get a good result, and it can take a long time, up to an hour, of just sitting there and really just polishing these edges, making things look really smooth, getting things to look like I said earlier, parabolic and up and down, and just developing these natural root prominences. Once you've done that and you've laid your tissue back over it, you get a much more natural appearance. And this is the final work, where the final amount of bone reduction, and you can hopefully appreciate that we were able to create these root prominences by trimming into these areas. We also obviously addressed the heights of the bone levels relative to the proposed veneer heights. And in the end, when you suture things back in place, you have a much more harmonious result. At this point, the patient was asked to return in 2 weeks to have a look. These stitches actually all dissolved. They didn't have to be removed. And she's going to return to Dr. Alex in about 6 weeks in order for all this tissue to finally mature enough so that he can start his next process.
Awesome. So after I get this, I now have this. So all of this tissue healed beautifully, perfectly, and you can see that this collaborative effort was in a sense that Eddie and I spoke about, here's where I could go with the initial first temporaries because I couldn't go any higher than that. But we had spoken about where we're actually going. So I started here with the temporaries, we peaked it even nicer. So if we look at how this tissue is, we're actually able to peak it even higher to get rid of that slope. And you can see it in the next photo that basically within my first temporaries, before I even did, because I have to then take these temporaries off, re-prep the case, and put in the veneers. And so utilizing the first framework to get to the final framework to finally get to our veneers. Look how we now have the balance between the centrals, the laterals, the premolars, even doing the molars over here. I mean, but the edges of the smile now and the sizes of the teeth are proportionate, whether it's on the left side or the right side. And let's throw it into the smile. Here's the smile. Here's how the tissue looks. Everything is grown in. It's all balanced with where the lip is. Notice how where her smile line is right there. The edges of those teeth, because if we look at it originally, these teeth were underneath the gum. These were way above the gum. The gums were up here. These gums were over here. This is where she started. Everything was angled. Everything was sloped. Everything is now balanced out. The gums look beautiful. They're healthy. And this is how you get longevity. This isn't just creating a pretty smile. This is creating a smile that lasts for many, many years. Like I say, typically 15 to 20 years, these set of veneers should last. And this case, we did 6 years ago.
That's right. And oldie but a goodie.
That's for sure. Awesome.